We're going to start off with acetaminophen, otherwise known as Tylenol. As you can see here, there are several products with Tylenol in it, so make sure to read the label. It works through the central inhibition of prostaglandin synthesis. Dosing is dosed from 325 to 1,000 milligrams every 4 to 6 hours as needed, not to exceed 4 grams a day. The regular strength is 325 milligrams. Extra strength is 500 milligrams. And the extended release is 650 milligrams. The lower maximum recommended dose for patients with liver dysfunction, 3 or more alcohol beverages a day, or if their intake is poor. Here we can see that Tylenol can be given to children less than 6 months. And here's the dosing. It is weight-based, and it is going to be 10 to 15 milligrams per kilograms per dose, 4 to 6 hours as needed, with a maximum of 5 doses per 24 hours. And here are the different formations of it. It comes in a tablet, a liquid suspension, and a suppository. There is a prescription Tylenol, but it is not seen often because it is very expensive. Now its competitor, NSAIDs. So here is a list of the available NSAIDs. We have ibuprofen, Advil, Naproxen, Ketorolac. So here is just a list of a couple of them. We do have selective and non-selective. The selective reversibly inhibits COX-2, and the non-selective reversibly inhibits COX-1 and COX-2 and prostaglandin synthesis. Box warning for NSAIDs. It does increase the risk of any cardiovascular thrombotic events like stroke or MI. It increases the risk of serious GI inflammation, bleeding. It is to be noted that this does pertain to all NSAIDs except aspirin. Adverse effects include increased risk of bleeding, edema, increased risk of cardiovascular events, GI upset, CNS effects, renal impairment, and history of peptic ulcer disease. Adult dosing is 1 to 2 tablets every 4 to 6 hours as needed, maximum of 6 tablets every 24 hours. And you can see it's available in 200 milligrams over the counter, but in the prescription, it's available in 400, 600, and 800 milligrams. And it is noted that the maximum dosage is different when it is over the counter versus when it is prescription. Pediatric dosing. So NSAIDs cannot be used in children under 6 months. It is weight-based, 5 to 10 milligrams every kilogram, every 6 to 8 hours as needed, maximum of 4 doses every 24 hours. It is available in a liquid suspension and a tablet. For children, we have Naproxen dosing. So it's Aleve, 220 milligrams, 1 tablet every 8 to 12 hours as needed. Next, we have Ketorolac. Comes in a tablet, 10 milligram tablets every 4 to 6 hours. And IV, it comes in a range, and it is based off of age. So under 65 is going to be 30 milligrams every 6 hours. Over 65 years old is going to be 15 milligrams every 6 hours. And it is noted that it should be used for a maximum of only 5 days due to GI toxicities. Next, we have Diclofenac, which is a topical formation, and it comes in a gel, solution, and patch. Here is a list of the generic and brand names and the dosing for NSAIDs. I would pause the video right now and get very familiar with these. Some clinical pearls for NSAIDs are they should not be used in the 3rd trimester of pregnancy. Diclofenac is the first transdermal NSAID available in a transdermal patch and topical gel. Celecoxib has the lowest risk for GI bleed, but you want to avoid Celecoxib if the patient has a sulfa allergy. And lastly, ketorolac should only be used for 5 or less days. Here you can see a side-by-side comparison of the two.